I would enter my patient's room, shut the door, close the curtain for privacy, perform hand hygiene, and introduce myself. Good morning, my name is Tiffany. I'm going to be your nurse today. Can I please verify your first and last name and date of birth? And I would compare that against their wristband. Thank you. And then I would explain to them that we are going to be changing their ostomy bag. I would put on my clean gloves, make sure I have all my supplies ready. I would first check it to make sure that there aren't any leaks. And then I would gently peel back the sticky, constantly asking them if they're okay. I would remove the ostomy bag. I would go and I would empty the contents of the bag into the toilet. If it was fluid contents from an ileostomy, I would measure the contents and record that. If it is formed, I would just dispose of it, but first I would notate the color and the smell. So I would cover this up and I would go and I would empty the contents and then I would throw the bag away in a waterproof bag, but I'm going to use it again, so it's not actually going to get thrown away. I would remove my gloves, dispose of those, perform hand hygiene, and I would put on another pair of clean gloves. And make sure that the area is clean. I would dispose of the towel. I would get my measuring tool and I would measure what sizing would fit the colostomy best. Once I did that, I would get this guy here out of its wrapper, and I would have a pen. I would place this on here and I would draw a circle, and then I would have my scissors to cut it out to make sure that it is the correct size. So then once that is done, I would just assess the stoma, make sure that, it's red, so make sure it's healthy. And I would assess for any tenderness and warmth, and everything feels good and everything looks good. So I would get my paste and I would put a layer of paste around the stoma. And then I would remove the sticky tape like that, and I would place it over here. Get my bag. Make sure that I get it on. I would roll this guy. You can clamp it. So we don't want any of those contents coming out, and this also helps, conceal the smell. And after that, I would have the patient put their hand there because I do want to make sure that it is a seal and that it is completely sealed. And then at that point, I would remove my gloves. I would perform hand hygiene. I would cover my patient. I would put their bed back to a comfortable position. And I would go and I would document my findings. And if there were any abnormal findings, like say the stoma was a grayish color or purple, then I would report that to the doctor immediately, because that would mean that the stoma tissue was dying and it would need immediate intervention by the doctor. Luckily, mine wasn't, so it's good. Otherwise, I would, gather my supplies, which all these were already thrown away, and clean up. And knowing myself, I would perform hand hygiene again. Make sure the patient has their call light, and I would go and I would document.